I have to ask, who's that picture in the background?
John Wayne.
Oh, I recognize it. Hi, and welcome to the Johnny Random Show. Thank you so much for joining us today. I have a special guest, Chairman Bryan Terry from the 48th District in Tennessee, and I'm just honored that he is sharing his time with me today. Chairman Terry, I just want to start off with what got you into public service?
Oh, well, yeah. Well, thank you for having me on. I appreciate it. And again, I represent District 48, which is the eastern half of Rutherford County. And for me, I've always been politically attentive, not necessarily politically active. And really what got me active, or a lot of times people, when you run for office, they say, what was your get off the couch moment? And for me, I was actually on call working at the hospital on election night. I guess it was 2012. And for lack of better terms, I guess, whether it's both sides, Republicans, Democrats, I felt like that election, the presidential election that night, I guess the term is, I felt like Obama was effectively dangerous and Mitt Romney was ineffectively dangerous. And neither one really, out of whether it's the values or put forth the ideas or represented me or did what I thought was best for my children and their generation. At the time, my son was in high school, daughter, I guess she was almost in transitional kindergarten. She was real young at that time. And I had gotten home from the hospital when the election results were coming in, and I went upstairs and apologized to my son. I said, my generation has failed your generation. I'm going to see how I can get involved. And honestly, I had no intent on running for office. I just had an intent on getting involved. And that following, I think it was either January, I'm an anesthesiologist, and there was a national anesthesia conference actually in Vegas. And it was a business political conference where we can go and get some continuing education credits and just kind of learn a little bit. And they actually have like a business certificate, and I was looking at potentially getting a business certificate through the ASA, but I wanted to sit down with the political folks and see how I could get involved. And I'm at one of their roundtable discussions, and they said, well, you realize both your state senator and your state representative are running for a bigger office. One of those seats is going to be open. You need to run for office. And I was like, no, I don't need to run for office. But they were pretty insistent that based on my ideas and things that I believe that I could win the race, and I needed to run and be a positive voice for medicine and for my children and their generation. And that, believe it or not, that night, I guess we were going to see Penn and Teller. And I don't even remember what hotel that they do their show in, but there's a restaurant there. And I'm sitting down with my wife, and I'm like, you're not going to believe what they told me. They told me I needed to run for office. And she looked at me and said, well, did you ever think about it? And so I started looking into it and asking people and going through neighborhoods, knocked on thousands of doors, and lo and behold, I won. So that's kind of how I got started into public service.
Nice. That's great. Just when I was reaching out to you, I specifically wanted to, ask you some questions on healthcare because you're, an anesthesiologist. I myself work in healthcare. I manage a dental office. So, it's something that's a little bit close to my heart as well. On the channel, I talk all kinds of politics, but, it's something that's sort of very personal to me as far as like wanting to try to understand what can be done. And so, obviously America is a very complicated, American healthcare is a very complicated topic and very multifaceted, obviously. So I just wondered what you think from a Republican perspective, what some of the solutions that can be put forward at a national level might be, what would be good solutions?
Yeah, and that's a great question. And to put that, I kind of want to maybe go back a little bit and kind of show where we were and where we are now.
Mhm.
Prior to the Affordable Care Act or Obamacare, there was the impetus behind Obamacare, I guess, was to force people to buy insurance, to be insured. And in theory, I mean, I kind of say that it's not just a tax on, the Democrats always talk about tax on the rich, tax the rich. Well, this is a tax on the rich in health. That you look at it is, and the thought process behind it really is you're insured. The pool of people that are insured. If you have those that are healthy that have to buy a product that has mandated items in there that they are never going to use, they are subsidizing the health and the insurance of somebody else. And so that was kind of their process that came through previously. Had people that whether insured or uninsured, you had more of a free market type of system of what type of plan you may want to choose. If you're young and healthy, you may just want a catastrophic plan. But then we had a significant amount of people that were just not insured at all and not in the system and not participating. And they would show up at at a hospital or something along those lines, and that kind of drives the cost up for everybody. And so that was kind of that process. There was a lot of drawbacks. There's still a lot of drawbacks within the Affordable Care Act. A lot of increase in regulations, the cost, you like your doctor, you can keep your doctor. That didn't pan out. And in fact, I will tell you that some of the things that the way that they look at it is, like I said, there's insurance company A, and they may have 10 products that they are offering that are now meet the qualifications for the Affordable Care Act, but there's maybe 3 that they're going to offer on the exchange. And those 3, they may do what's called a narrow network. And so I, as a physician, may qualify and meet the contract for these 7 other plans, but then they won't let me in these other 3. And so, like your doctor, you can keep your doctor. Well, they might not let your doctor in that plan. And so that's by having a narrow network. That's how they say they cut the cost, because if they can contract with one doctor as opposed to contracting with 10 doctors, if I tell you you're the only doctor that's going to be in this plan over here, but I'm going to pay you 75 cents on the dollar, but you're going to get all the business out of this plan, then you cut somebody else out. If they don't narrow the network like that, it may be 85 cents on the dollar that they're doing. So that was the Affordable Care Act when it got put in. Obviously, the concern was, we know even beyond that, when Bill Clinton was president and Hillary Care was coming in there, and that was a total disaster of what that was going to be. A lot of concerns that Americans rightfully had was that who was going to be president after Obama. And you really didn't want Hillary Clinton being in control of your health care. You still don't want Hillary Clinton being in control of health care. That being said, we got President Trump, and the concern or the issue that I have, and it goes back to why I ran for office. You have people like Mitt Romney and John McCain that weren't willing to work with President Trump on issues like healthcare. And so that was the vote where, McCain did the thumbs down on there and voted no against the repeal. And that was, I think a lot of folks were looking for a repeal and replace. And there was, I think, Congressman Rowe had a version of a plan that he had. And then I think there was another congressman out of Georgia that had a plan that they could have used to replace. But I think that the issue really, that was something that I felt like President Trump at the time needed to lead on, and he needed to put out his own plan. And really, I think they were waiting to see what happened if the vote was going to be there to repeal. and then push something forward. And I think that was a very much a missed opportunity from the Republicans at that point in time. Come today, what can Republicans do? Well, right now, and this was something I remember in one of the debates that between Trump and Biden, and I don't think that Trump did a very good job of putting this out, but when it got voted down by McCain and then Republicans lost the Senate, you have to work within the framework of the laws that are in front of you. And so how do you maximize those type of things? And so he did a poor job of saying that was what he was trying to do was, well, we're stuck with Obamacare for right now. I'm trying to maximize those type of things. And one of the things that he did put forward that I think that that's part of the Affordable Care Act and something that I've tried to get pushed forward under these frameworks is the state empowerment and state relief and empowerment acts. And there are, it's basically 4 different types of, they're called 1332 waivers.
Right.
And so within the framework that we have, states could, let's see, there's account-based subsidies, there's state-specific premium assistance, there's adjusted plan options, and there's risk stabilization strategies. So let's take the risk stabilization strategy for one. If you have a group of people that are uninsured, and right now in Tennessee, depending on who you talk to, there's maybe upwards of 600,000 that are uninsured, mostly healthy individuals. By choice, they're not out there with insurance, but really, if they had catastrophic care or a plan that, if they ended up with a major injury or, contracted leukemia or, had some major disease that they had, but they had it as a catastrophic plan, they potentially could have lower premiums and still, be able to participate and not have the big bills that would bankrupt them. The account-based subsidies would be utilizing either state funds or federal funds to pay certain premiums. Again, that's like the third one's the state-specific premium assistance. So the question is, though, where do you get those funds? How do you match those funds? A few years ago, it actually was before COVID hit, I had run a bill for the state just to look at these type of plans, these 1332 waivers, and see what the feasibility of doing a waiver for the state could be. And I got what's called a fiscal note on that bill. It would go through the Department of Commerce and Insurance.
Yeah.
And they, the way that they describe it is that it's a pretty lean office that they have, and they would have had to hire new actuaries and other people to do this type of study. And it was close to $100,000 it was going to cost. And then COVID hit, and pretty much at that point in time, anything that, the budget, if it had a fiscal note, it wasn't passing, and everybody, the budget got contracted, and we're just trying to, we had no idea what was going to go on with the economy. And so that was something that I tried a few years ago. And then last year, I worked with some folks and had a more expansive thought process on how we could do that. And it was really trying to just get the conversation going. And that, I think, ended up going to summer study to look at. And then again, this year, there just didn't seem to be an appetite for us to do that type of thing. And one of the things that I think the appetite, at least from my perspective, is Georgia enacted a 1332 waiver. And their plan got challenged by the Biden administration, was in court. And so the concern for us was, if we put our own plan forward and we don't know if the Biden administration is even going to allow these anymore, we're wasting their dollars and wasting resources for something. And my understanding, I think maybe in last month or a few weeks ago, that the feds turned down Georgia's 1332 waiver. So that's something we're going to have to take into account and see. All that being said, we've got new elections coming up. I believe there's going to be a red wave. So you will likely have Republicans hold the Senate and the House. And while it's not in the list of issues that are out there right now, economy being, major issue, the healthcare is obviously an issue that people have concerns about, but that's not the issue right now that's driving people getting them active right now. But I would say that Republicans, when they take over the House, take over the Senate, need to have a plan, whether it's a vote to repeal certain parts of the Affordable Care Act, vote to repeal it all, make Biden be on record, voting, vetoing these type of things. And then whoever is running for president in 2024, it would be in their best interest and the best interest of the country for them to put forward a contrasting plan that helped, all Americans.
Yeah, that's all a very good, I think, articulation. And I it was in the military and was very sort of head down, kind of not really paying a whole lot of attention during that election, 2012. But I remember having similar thoughts, that there doesn't seem to be a focus on the Republican side of what would actually be a replacement. I'm sorry, I meant during Trump, when Trump was
Right.
there, his focus was on immigration. But it's funny to me that I see, nobody was talking really about immigration until Trump brought it up, hammered it home, and he basically won on that issue, and
Right.
it got him into there. And I see, like you said, a opportunity for Republicans to have, take this issue, take ownership of this issue. And because I see it as something that's on everybody's mind, but on the back of their mind, on the front of everybody's mind right now is inflation and the economy and things
Exactly.
like that. But if you could take an issue, like this, and that everybody had it's obviously a big concern. Another thing that I wanted to ask you kind of on that note is, I don't know that the Republicans have a framework or consensus framework for what we should do with healthcare. On the Democratic side, you seem to have a very sort of a consensus that the government should have a program that does something, and they, single payer, whether it, compromise into that Obamacare, thing. It seems like the Republican side, it's very almost libertarian to the point where we just get completely out of it. So I think that that's, in my mind, in my estimation, you might disagree with that, assessment, that there is no replace, because the point is to repeal it. And if we're going to repeal it, then just get government out of there. There is no replacement, because all government bad. And I think that, for a conservative to win this argument, just in my, view, would be that someone would have to say, no, there is a role for government to have regulations that make even playing fields for everyone. And it's something that you also touched on, how Obamacare was, it was getting more people in the pool, right? So you had to get those people in the pool to offset the cost of insuring everyone. So you have it can't be a right. It can't be something that you force doctors into, and also be something where you can control the price. That's really hard to control the price. It's only going to drive the price up when you make everybody get a product, because, supply and demand, right?
Right.
So the philosophical underpinning, to me, that is not there for the Republican side to say, okay, we're going to make it affordable options, but then do we force everyone to buy it or not? That's where
Right.
It's if you give them options and they choose not to do it, then do we force them to do it, or we don't force them to do it? And you're left in this, I think that we're left in this sort of hybrid situation that we're in right now.
Right.
So I don't know if I articulated that well, but hopefully there's something there that you can.
Yeah, you have. And, and you really need to think about overhead, really,
Right.
and the economics of this. And so years ago, overhead for medicine used to be, 30 cents on the dollar. Now with more regulations, Affordable Care Act, different things coming in here now with, the inflation going on and other market prices going up, it's, doctor's offices and doctor's practices, sometimes it's upwards of 75 cents on the dollar is how much you're having to pay in overhead.
Mhm.
And if you know that the Democrat or the single payer system, Medicare sometimes pays as low as 25 cents on the dollar.
Yeah.
Medicaid or TennCare often pays as little as 10 cents on the dollar. There was even I can't remember, I think it was a Democrat out of North Carolina that ran for president last time, even said that type of system where you're having a single payer system where it's Medicare for all, does not pay the overhead. So at that point in time, you're not going to have any people going into medicine. Who's going to want to be in a situation where you can't afford to pay back any of your loans, your student loans, or anything like that. You said that, Democrats oftentimes look at, Medicare for all or the government system. I look at people being in, it's really kind of 5 buckets. You got the Medicaid bucket, you got the Medicare bucket, you have uninsured, you have the private insured on the exchange, and then you have the private insurance bucket. The question is, if you take the uninsured and put them over here, and you know that you're going to get 25 cents on the dollar, 10 cents on the dollar, and you can't keep your practice open on those type of patients, there's going to have to be more subsidies or something's going to have to do that. Or those types of patients that are otherwise healthy push the patients that are in need out of the system. So the question is, how do you get those uninsured over to this other side now? And that's whether you do like a 1332 waiver, something that assists that, where their employers are paying to help with that. I will say that, like for the Affordable Care Act, those that are uninsured, and this goes back to some corporate idea of medicine. If you know that somebody has to work 30 hours a week to get insurance, but they can only make a certain amount of income, I think I did the math on this years ago. It was like if you paid them $30 or 30 hours, they could make like a little over $9 an hour. That's all they were going to make. They weren't going to go up to $15 an hour, but they were going to have insurance potentially. If you paid them for 40 hours, they were going to make $825 or $850. I can't remember those exact numbers. Mm-hmm. So from a corporate standpoint, if you know that government's going to pay for your insurance, for your healthcare, and you don't have to pay them a wage, a lot of corporate practices, that's something that they want. And when you look at Republicans, there's a lot of Republicans that are for the patients and for the individual. There's a lot of folks out there, whether it's Republican or Democrat, that are big business individuals that look at that from that aspect. I will say that, and this is something I've said medicine has kind of gone towards this, and it's gone towards it more now so with the Affordable Care Act. You have corporate medicine, which puts profit over patients. Yeah. You have government run medicine, which essentially puts paperwork over patients. Each of those I consider what's called widget medicine. Uh-huh. They look at nurses and physicians and patients as a widget. How can we maximize profit on one end for the corporation? On the other end, it's how can you not pay providers? In that instance, who's going to go into medicine? Yeah. To me, the third option, the option that needs to be out there, is patient-centered approach, where it's driven by the patient-physician relationship and getting back to those type of situations and having in those buckets where the providers and the patients have the control back. And so whether it's, a 1332 waiver or a different plan that provides or puts the focus back on the patient and patient-centered care, that's what I think whoever comes up that's running for president or Congress that comes up with that solution, I think is going to have a winning solution.
Yeah. I agree. I think that, at one time I wanted to be a dentist. I wanted to go to school to be a dentist. But after having managed the office and been, on the insurance side of like coordinator for many years and everything, I can't imagine, wanting you know, to work and work for what the insurance says. I can and can't, does and doesn't cover, and they're only going to pay this much for this much. So that, that shouldn't influence care, right? But it's always on the back of your mind, like, okay, I'm going to take a hit on this, but I'm doing what's best for the patient. That's not a positive environment for doctors to be in, I don't think at all. And I think it influences, now they're looking at, how can I pay off all these student loans? How much time is it going to take me? It's not a good environment for the providers these days. And that to me is like I said, this issue is a very big issue to me. And if the next, president or the next person who's running doesn't take this into consideration, I just feel like it's going to get worse and worse and worse. You're not going to stop the corporation from maximizing profit,
Right.
and using every free market available, avenue to maximize profit. That's what they're good at. That's what corporations do, and there's nothing wrong with making a profit, obviously.
Right.
And I sometimes get criticized for being like really easy, soft on Democrats and hard on Republicans. But I think, the way I think about it is I'm not going and, chewing out the neighbor's kids. I got all kinds of problems with the Democrats,
Right.
single payer, and I could, tear down the ideas and the concepts of single payer and why it doesn't work, any day of the week. But what like really my mission or goal is to try to steer the conversation on the Republican side of the coin towards how do we take these things into consideration? How do we articulate this way in a simple way and just take the message over so that we can actually have something positive to run on and give something better to our kids than what we have right now, because it's trending in the wrong direction.
Yeah. And to your point, healthcare is not, I mean, we've spent 30 minutes discussing it, and it's not a simple, I mean, the simplest way I've come up with is basically it's widget medicine right now. And we need to get away from that, but it's, and that's, I'm going to have to go here just shortly, but one of the things you talked about, or you'd asked me to discuss, was what can the youth do to get involved, and those that have concerns about, the direction of healthcare. And I just want to, I have people job shadow me all the time, students, and I ask them, what are the 3 types of doctors? And usually they say, well, there's primary care, there's surgeons, and there's specialists. And I said, well, yeah, that's true. But the 3 types of doctors really are those that are entrepreneurial in spirit. They want to own their own business, and they want to be able to market themselves. There are those that want to own their own business, but they want to be contracted so they don't have to market as much. And there are those that want to just be employees.
Yeah.
Years ago, the vast majority of physicians were in those first 2 categories. And now, it was actually before I got into office, they did a survey, I think it was Vanderbilt survey, and they said more and more residents that are coming out and people that are in medical school just want to be employees and not have control over their practice or their patients. And you're seeing people pushed more and more to being that. And my concern is that if you have a single payer system and everybody is pretty much a widget as a physician or a nurse or whatever at that point in time, the spirit that you have and the passion that you have for patients is not going to be there. And we need people that have that passion in medicine. I mean, I've got health issues, and I want, people like that taking care of me. And so to me, that's one of the things that the youth that have those type of drive, they need to be going into medicine. They need to be active. Talk with your providers, talk with your local elected officials, your state representatives. I tell the physicians or those that residents or medical students, I tell them, when you get out, do me a favor and go talk to your state rep, go talk to your state senator, go meet them for coffee, and be a resource to them, and let them know that this is where medicine needs to be focused on patients and the patient provider relationship.
Yeah, well, that's great. I think it's a great positive place to wrap this up. And I just want to thank you so much for your time, and love to do this again sometime. And that's all for today's episode. Thank you.
Thank you so much.